Hi, everyone. Good evening. We're going to get started soon. Okay, thank you for joining us tonight and welcome, everyone. We really appreciate that you're here tonight. First off, we wanted just to start by wishing everyone all the best for the start of the new Islamic year and the month of Muharram. May the blessings of this month and today, the day of Ashura, bring peace and prosperity to everyone. My name is Caroline Riseborough. I'm the president and CEO of Trillium Health Partners Foundation, which is the fundraising and community engagement arm of the hospital. And I just want to take a moment to thank each and every one of you for your commitment to Trillium Health Partners. We are building on historic support, which includes the Muslim community who made a historic $5 million pledge in 2020 to help build the future home of the Peter Gilgan Mississauga Hospital. To this day, this commitment and donation remains the largest philanthropic gift in Canadian history to a hospital from the Muslim community, for which we are so grateful. This effort has been led by Trillium Health Partners Foundation, Board Emeritus and fundraising volunteer member, Mr. Abdul Khayyam Mufti, known to us as Mr. Mufti, and several other dedicated leaders from across our community. Throughout this campaign, our generous Muslim community has raised over $3.1 million to date, which consists of over 2,400 unique donations from individuals, families, mosques, community groups, and companies. So you'll see that these pictures are only a few of the faces behind this historic initiative. And there are many, many more people who have participated that we weren't able to picture here, but again, together, they make all of this possible. So thank you to everyone from our community and particularly from the Muslim community who have participated to help us build the new hospital. The remarkable results show the strength of this community uniting behind such a powerful cause to benefit our entire region. So thank you for taking the time, everyone, to participate in this town hall to hear from my hospital colleagues about the exciting changes coming to healthcare in Mississauga and the entire West GTA. And we look forward to hearing from you as well. I also want to thank THP board member Ahmed Ataya for joining us today as a guest. Ahmed lives with his wife and family in Mississauga. He is CEO of Incisive Strategy and renowned for his proficiency in public relations and crisis management, having established his firm as an industry leader in 2016. Ahmad's community service and human rights work have earned him several awards, including the Queen's Platinum Jubilee Award and the Voice of Justice Award. He also serves as a board member of the Muslim Council of Appeal, actively engaging in community advocacy and support in our region. So again, thank you everyone for joining us tonight. And now it is my immense pleasure and privilege to introduce Carly Farrow, the President and CEO of Trillium Health Partners. Over to you, Carly.
Great. Thank you, Caroline. And thank you, everyone, for joining. And I know we are just kind of past the time that we sent out to the community to let them know to join. If we notice more people are joining, we'll try to recap where we're at and make sure there are introductions. I'm so pleased to be here with you as your CEO of Trillium Health Partners. And I'm joined tonight by, in addition to Caroline and a number of colleagues who have supported us with this town hall. But I'm joined tonight by my colleague, Farah Khan, who is our Senior Vice President of Patient Care Services. Farah, do you want to give a shout out?
Hello, everyone. Salam.
So Farah leads all of the regional, major regional programs for Trillium Health Partners across a wide variety of specialty areas and probably some of the largest specialized programs in Canada. and is a nurse by training, an exceptional executive leader and engaged community member. And we are very lucky to have her on the senior team, leading the way for us on all matters quality, practice, and operations in patient care services. So really, really happy to have Farah with me tonight. And also Sean Kerr, who some of you know, if not all of you on the call right now, who is our Vice President of Public Affairs and is in the community often as we are working to engage our community on the work that we have underway. So tonight, what we wanted to do was share with you a little bit about the projects we have, but really we like to take this opportunity to start at the very beginning to ensure that you have lots of information about what Trillium Health Partners is. It's a big hospital, actually the biggest hospital by many measures of size across Canada, and we are a leading academic teaching center with research embedded into our hospital. So I'm going to talk a little bit about what THP is, then I'll spend a few minutes talking about the kinds of priorities that we're focused on today as we then look to the future and how we are building the future of healthcare right here in Mississauga with the help of our amazing community. So with that, I'm going to jump right in, and I am going to call on Farah throughout the presentation, as she is my clinical expert on the call with us tonight. And we also then want to hear from you. It's really important we hear from you on questions you may have and on feedback that you may have in terms of where we need to prioritize as we go forward. Okay, Lauren, I think we're going to get right into it then. So we're going to move right along into the presentation. So just to center us in terms of what Trillium Health Partners is, we are, as I said, one of the largest hospital networks in Canada, over 1,500 beds now, I will say, of healthcare delivery across 3 main sites, the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Centre. We serve the entire region with highly specialized programs, and that includes cancer, cardiac, chronic kidney care. You see there genetics, geriatrics, maternal child, neurosurgery, palliative stroke, vascular. These are end-to-end from birth to end of life, and some of the most specialized programs that are delivered in Ontario. And that's something that people sometimes find is an interesting factoid. We have world-leading specialized care right here in Mississauga that has been built. We also are proud to serve one of the most diverse communities in the world and a growing economic hub. And we know that to be a contributor to the health of our community means really talking about how we actually contribute from the health of the community and the ability for everyone to access the right care that they need at the right time. So let me talk a little bit more about that. I'll dive into just a few factoids here by the numbers. THP serves over 1.7 million patient visits per year. Many of those are people who reoccur because we do have an aging population and more people that we care for that have multiple chronic diseases. We also are the #1 center for birthing in Ontario. So that is over 8,500 births are delivered at Trillium Health Partners, and we are #2 for overall surgeries in Ontario at over 67,000. We like to let people know that we have combined emergency department visits of 225,000 plus. And just to give you a little sense of our hospital partners downtown Toronto, if you combine all of University Health Network, that's the Toronto General and Toronto Western and Princess Margaret Hospital, but particularly the Toronto General and the Toronto Western, plus Sunnybrook, plus Sinai, our emergency department is bigger than all of those combined. So the size and scale of our organization is vast. Now we're going to turn to the next slide. And I want to wrap that all around what we are focused on as a hospital altogether. So we think about our mission as a new kind of healthcare for a healthier community. Trillium Health Partners was created in 2011 when we combined those three hospitals that I referenced at the beginning, the Credit Valley Hospital, the Mississauga Hospital, and the Queensway. And our focus really in coming together was how do we deliver the most highly specialized care closer to home within an interconnected system of care, because we know that people require care not just in the hospital, but in the community as well. And people want to be able to stay well in the community. So how do we act as great partners in connecting with care outside of our walls? And then how do we deliver the kind of thinking to shape a future where we are actually contributing to a healthier community overall? When we think about that, we hold the three values core to what we are every day: compassion in everything we do, in caring for you, our community; excellence in terms of the highest benchmarks and standards of delivery of excellent high quality care; and courage to change the system to ensure that it works for our patients and families and community. And we balance all of this with our goals to improve quality access and making sure that that is done in a sustainable way. So that's a snapshot of what Trillium Health Partners is. And today we're going to talk to you about the work that we are doing to continuously work to improve for today as we look to tomorrow and the future. All right, so I'm going to move right along here. And we're going to start by just giving you a sense of what many of you will be able to relate to directly because you have interacted with the healthcare system. And we do receive this feedback on a continuous basis from our community, our patients and families, that there are many challenges facing healthcare. And Trillium never tries to shy away from the issues that we are facing. In fact, as a hospital, we courageously acknowledge the issues and are working to make the changes that are required to improve the system. So we know that we serve one of the fastest growing populations, and that means that we have to do more to address wait times. And so in particular, when you think about a community like Mississauga, where we have moved from a small community that would have started to grow up in that kind of 60s, 70s era into a suburban and now urban community, what we haven't seen is the kinds of services like healthcare move as quickly as the growth of the community. So that is why Trillium actually is the hospital that has the greatest capacity needs in the entire province, if not the entire country. We believe that that's a challenge that requires innovative thinking and something we're focused on, and I'll talk a bit more about, and I'll ask Farah to chime in on some of the things that we're doing. We have aging buildings. So the Mississauga Hospital and the Queensway Hospital are two of the oldest facilities in Ontario, having been built in the 50s and prior to that. And so really focusing on infrastructure that delivers what we need for modern healthcare. We know we have people who are living longer, which is phenomenal, but they have more complex needs that we need to address through different ways of delivering healthcare. We have growing social inequities in our community and across all of Canada, in fact, but understanding how we address as a hospital the achievement of better health for everyone, leaving no one behind, is important for Trillium. And then, of course, what we face every day as we work to improve access to care is how do we attract and retain the most talented people to work with us as we try to address these issues. I note here that we talk about waiting for long-term care. This is a top issue that we've heard for many, many years at Trillium and in our community. And one of the reasons why Trillium actually helped create in the last 3 years a new organization, not-for-profit organization called Partners Community Health. And Partners Community Health is focused solely on seniors care, and they are the deliverers of long-term care. So with that, let's keep moving along here. And we will get right into the things that we are focused on to improve the healthcare system. So I'm going to just start out here by addressing the fact that we are thinking continuously based on the feedback that we receive about the kinds of priorities that we set. So we don't set those priorities in a vacuum, only talking to ourselves at the hospital. We do that through many forums, including engagement sessions like this, as well as overarching engagement throughout the community, in addition to regular surveys that we provide to our patients and families to get feedback. So we know these are the top issues that our community faces: better access to care, including shorter wait times. This includes when you come to the emergency department and when you require surgical care for the kinds of specialized programs that FARA oversees. We know that we need to deliver care closer to home with the most highly specialized and talented healthcare professionals, as well as the equipment, including things like MRIs, CTs, robotic equipment to deliver those services. We know we want a better patient and family experience, and later on, I'm going to actually ask Farah to speak to some of the things that we are focused on to try to achieve that. In the last 3 years, one of the things we have focused on is improving online patient records and being able to provide you with your patient record, as well as being able to provide digital translation services. We're delivering more connected care. I mentioned this. Delivering hospital care alone is not what is going to help people stay healthier in the community closer to their home. So we are creating new programs like at-home programs, and I mentioned Partners Community Health. So we know that healthcare is the top priority for our community, and that is something that we take very, very seriously as we're building our plans for the future. Okay, moving right along. So how are we making this happen? And we're going to talk about, first and foremost, the things we are doing today to focus on better healthcare in the here and now. So it starts with the people that provide the care. So we're going to talk a little bit about our talented team and how we're growing it and retaining people here. We are going to talk about more capacity for better access to care, and then how we're doing things differently to change the way healthcare works in the first place. Okay, let me just dive into some of this with Farah. So Farah, I'm going to turn to you in a minute to talk about what we are doing to grow and retain our talented team. But just to give you a little bit of an overview of who we are from a people perspective, we are one of the top employers in all of Mississauga. When we include our learners and our volunteers, we have over 17,000 people that are affiliated working with the hospital. And that includes over 1,400 doctors who are working across all of our sites, and they include some of the most specialized individuals in the entire country. The picture you see here is of our cardiac surgeons at THP, who are world-renowned cardiac surgeons that deliver the best care as close to home as possible. We have over 4,000 nurses, 797 hired in the last year, and you can, and Farah's going to talk a little bit about what we're doing to support that. And so all of this to say, a top focus for us is our people, growing our talent and investing in them. So Farah, do you want to talk a little bit about how we focus on our people to make Trillium the great place that it is?
Well, first of all, it's an honor that Carly has brought me to meet with members of our community, because I'm a member of the community too. And so it's a privilege and an honor. I'm very proud of where we're going on growing our teams, and I'm a testament of that. I started at Trillium Health Partners as a volunteer at age 18, which, by the way, was just a few years ago. And I worked my way through from being a ward clerk to becoming a nurse, and then working my way through back to Trillium after advancing my career. And so this is where we are focusing as an organization on building talent, expanding leadership opportunities for staff. And the number one thing I think I feel proud about is that our organization has a focus on equity, diversity, and inclusion. And we are embedding in the growth of our teams, the empowerment of our teams, and the cultivating of our teams through those EDI principles. So as an example, we work with leaders like myself in pairing people who are interested in advancing in their careers, whether it's leadership or whether it's just advancing in roles. And we have a program called Invitation to Leadership. You can see that Carly was talking about recruitment and retention of staff, including internationally educated professionals. And so we do have a program for internationally educated nurses in which we are actually helping clinicians come and get integrated into the workforce and building communities of practice. Carly, I don't know if you want me to say anything else on people.
No, that's good.
You actually prompted me on a whole bunch of things. I don't want to forget. You prompted me on.
Keep going, because I'm going to call you back in and to talk about bringing to life what we're doing every day. But thank you for the highlight of some of the programs that we're focused on. Trillium is a people-focused organization. In fact, last year, FARA was a part of the leadership team on the clinical side, bringing to life a major accreditation with the National Accreditation Body, of which we scored 99.7% on all quality indicators. And one of the #1 pieces of feedback we received from Accreditation Canada was this organization is all about people. And I'm incredibly proud of the work that we are doing, as Farah said, to make this the most inclusive environment. And that includes for internationally trained people, creating dedicated programs and mentorship programs to ensure that their incredible skills and talents can be built into our teams at THP. Okay, let's keep moving on and talk a little bit about how we are getting to the issue of capacity, and that really is about reducing wait times. So we know that while we're going to talk about the projects that we are building for the future that are so incredibly important, and the support from our Muslim community, an incredibly historical investment, we know that wait times are happening now, and we are focused on that in an incredibly dedicated way. So I want to assure you, our community, that the ways that we are focused include advocating for more hospital beds. And we have opened up over 200 new hospital beds since 2018, as you can see. That's required us to shift the way we deliver services, to add more beds into our current physical plant, in addition to adding new beds in partnership with sites outside of our hospital. So for example, when Humber River Regional Hospital opened their new hospital, that gave us an ability to use some of the space that they have within one of their older hospital sites. The same is now happening with West Park, which is now a part of the University Health Network in Etobicoke. They've just opened a new hospital, and we are going to be able, until our new hospital is open, to access hospital beds in their older site. While this is not ideal, because those sites are not directly in Mississauga, they do create the capacity we need for people who need to be admitted. And we do a lot to ensure that it's a seamless experience with the standards of care that Trillium establishes. So we've listed some of the ways that we've added that capacity, and I've mentioned it. I do want to call out, I mentioned to you that we created our own organization, Partners Community Health, to be dedicated and focused on seniors and long-term care. We opened earlier this year a brand new 632 bed long-term care facility in Mississauga. That is the biggest long-term care facility in Canada. It's actually the same footprint as the Credit Valley Hospital was when it opened its doors in the 80s. And it is state-of-the-art. It has things like dialysis and virtual care. It is a new kind of long-term care. So all of these things add up to new capacity and more beds in our hospital that then in turn allows us to reduce the wait times for care. I do wonder, Farah, maybe if before we go into the next slide, do you want to just say a few things about how we are focusing also on surgical wait times, because specialized care is something you oversee, and maybe just a few kind of examples of the work that you are leading with the teams to reduce surgical wait times.
Sure. We have a number of platforms that we support surgical care, whether it's cardiac care, neurosurgical care, and then all other specialties. From a cardiac care perspective, we continuously implement innovative technologies that can shorten our wait times, address cardiac care in a timely way, and create capacity for increased care for the community. From a surgical platform perspective, wait times have been an issue that we've been really focusing on in recent years, especially after the pandemic. For our orthopedics population, we've actually been focusing on innovation that brings our length of stay down for patients, so they actually have less invasive surgery that allows them to have the same procedure and to go home faster, which has been great. And that requires all sorts of interprofessional interventions like pain management and post-operative care at home. We've also been working between our 3 sites to create additional operating room time, and that's through negotiating and advocacy as well as creating bed capacity, which allows us then to create more operating room time, fixed time, so that those patients coming in who need urgent or time-sensitive operations can do so in a more focused way. And so instead of waiting in the hospital for access to the surgical platform over, say, 5 days, waiting in a bed for your surgery, now patients who are safe to do so can go home, and we have been able to rearrange our surgical time so that patients can come in a more fixed time, have their surgery, recover over a short period, and then go home. So those are some examples there, Carly.
Amazing, Farah. Thank you so much. And so we want you to know that this is our focus each and every day. And as Farah described, we really do try to use all the latest innovations, the ways and techniques that our teams work together to expand that care, just to accentuate that care then delivered by the highest quality, the most talented people, and attracting those people to our community is a top priority. Okay. Next slide. I want to talk a little bit about the things that we are doing differently. We know healthcare needs to change, and this is a continuous improvement and innovation organization. When we actually became Trillium Health Partners in 2011, one of the first things that we did was create a research institute called the Institute for Better Health. And it is a center where really talented people help us focus on all manner of research and innovation, and help us feed into all kinds of practical, real world research and evidence that can lead to better health outcomes. So let me give you a few examples, and Farah, I'm particularly going to ask you to talk a little bit about how MyChart works, because I think that's something that's important for our community members to understand that we've implemented. But I want to mention a couple of things before I turn it back over to Farah. And Farah, you can mention anything else that's not on this list that we may have missed here. Virtual care is something that is, since the time of the pandemic, is one of the positive things that came from the pandemic, and we have been a leader in virtual care. Trillium uses virtual care to support our long-term care homes. We also use virtual care and are testing new models of virtual care to support individuals into the community. So we hope to see more of that. One of the ways that we use virtual care across all of our sites actually is to connect specialists who may be at one site into another site where they can do consults with the physicians that are there. So that's really, really important. And we see that as an advent to the future of healthcare, where you can consolidate and really maximize the time of your specialists, but have them connected to people in the home through partnerships. I want to talk a little bit about translation services. The picture you see here is a picture of, I think this is a virtual care picture. We have another picture of our translation service that we were a leader in at Trillium Health Partners, and that is with an organization called Voice, where we now are able to instantaneously, through a virtual system, just like the one you see on your screen, connect to, I believe it is over 400 languages immediately, where a translator will come on the screen with our for our physicians and nurses, and interact with our patients and families and our clinicians right in real time. It takes about 2 minutes to join in. It's a game changer. The language barrier can sometimes be an incredible barrier to achieving all of the information a clinical team needs to have to understand how to deliver the best care. And it creates a great deal of security and comfort for our patients and families. So we've been proud to be one of the leaders in using this technology, which is now scaling across Canada, to improve quality of care and patient experience. I'm going to now ask Farah to talk a little bit about what MyChart is, because empowering people with their own health information is a big priority.
So thanks, Carly. As some may know, we implemented an electronic health care system digitally during the pandemic called Epic. And so what MyChart is essentially a secure patient portal in which we're able to connect patients' personal health information through that documentation tool called Epic. And it's essentially a digital record of that patient's healthcare record. And so patients and anyone they delegate through a secure portal can access things like appointments. I love it actually, because I have my parents and my in-laws on, and I can go in and check when their next appointments are, what their recent lab diagnostic imaging test results were, and you're able to make informed decisions, but also stay connected with the clinical teams. And many of us know, if we've been through healthcare, the healthcare system, it's very difficult to access that information. And so what we are providing is essentially a one-stop shop, and that enables, kind of two-way communication with patients at their fingertips, and it can be used through desktop, iPad, and phone as well.
And if your parents are like mine, who do receive cancer and cardiac care from our hospital, they also use MyChart and then have learned how to use ChatGPT to understand some of the things that they don't understand. It's a whole new dynamic of patient engagement, but we love to see it because it does give people a more empowered feeling over their information. And that program that we invested in is something that was made possible because of the way that we work together as a hospital to achieve kind of that scale and able to make those investments. I talked a little bit already about THP at home and connecting people with the acute care services we deliver at THP, and bringing people into the home faster with connectivity back to THP. And I also talked about Partners Community Care and long-term care. I want to do just a call out on our pediatric care. Something that is a really important advancement that was made over the course of the pandemic is, and we're going to talk about the new Shaw Family Hospital for Women's and Children's that will be built into this hospital behind me. But we introduced a new pediatric care clinic during the last couple of years. And so now what you have is all of our specialized pediatric inpatient services at the Credit Valley Hospital while we wait to build our new Women's and Children's Hospital, Shaw Family Hospital. But then we have a pediatric care clinic that is at the Mississauga site. So what we will always do is connect those services for everyday services, because we know families live all over the city. And so we want to be able to connect them into hubs of service like this pediatric clinic. But then if you bring all your resources together, that's what's allowed us to create the scale for us being able to create a new Women's and Children's Hospital. So just a few examples. With that, I think we better move into an overview of what we are doing for the future and planning our future sites, which you, this amazing community, have so graciously supported. So let's keep going here. We're going to go into the pictures of our new hospitals, which is very exciting. Let me start with the Peter Gilligan Mississauga Hospital. Farah, Sean, Caroline, anything I miss, please jump in. This is such an exciting hospital that will be built right at the corner of Hurontario and Queensway. Your new Peter Gilligan Mississauga Hospital will be the largest in Canada. It is one of North America's tallest and biggest and most extraordinary hospitals. And that is because it provides end-to-end specialized care. It is an academic world-leading center, and it will include total connectivity through virtual care into the community. As you can see here, we've listed, it'll be 22 stories high. Just to give you some context though, that is the equivalent of a 33-story condo building. So it is very big. It's not as big as the Marilyn Monroe Towers in Mississauga, but it's almost. So coming up that Hurontario, this is an important facility. I want to say something important. This entire design is around healing, wellness, and what we consider the important components of a healthier outcome, which is combining body, mind, and spirit. And to do that, we have incorporated, in addition to the highly specialized services, like you see here, 23 operating rooms, an emergency department, over 950 acute care beds. We have also included important spiritual care centers in this hospital facility that will be woven into the fabric of an inclusive healthcare facility. This is very, very important for our entire organization and community, and will allow for the kind of supports that everyone needs when they're supporting family members, when they are patients at our hospital, and when they are people working at our hospital. So we're really, really proud of the work that's going to go in to the not only the specialized healthcare spaces, but those distinct spiritual spaces. There are two separate and distinct spiritual spaces that we have in this facility, where all faiths and ceremonial practices can exist side by side. I want to call out that we've paid a special attention through the design to have things like dedicated ablution space. This is something that's very important, and this is a community resource. These are highly specialized services, but they are where we are all going to feel that healing and that centeredness to our community. So we're very proud that this will include, and as we get further in the building of this hospital, that's where we'll be able to engage the community more in what these centers look like and feel like. This is also, I think, the first, I think we said, Sean, 100% private room hospital, and that creates a lot of improvement in terms of privacy and how we create those healing spaces for individuals and families, as well as, you know, what that means. 100% private rooms, 100% private washrooms, all of this state of the art, but also designed for individuals for that kind of inclusive, equitable, and accessible facility. I mentioned already the importance of, this is a massively huge hospital. It is also the home of the Shaw Family Hospital for Women and Children, a first of its kind, and an important specialized center for our community that will see things like more surgeries, more care for children living with mental illness right here in our community. This is historic, and we are incredibly grateful to the Shaw family, who have recently named this hospital the Shaw Family Hospital for Women and Children. So you can see that there's site activity here now. As we prepare the site, there are buildings that need to be removed because we will fully start construction in 2025. It's probably, we're going to come back to the community with exactly when construction ends. but everyone should expect that it's going to be approximately 8 years of construction. This is a very complicated project, but it will be worth it. Okay. Bart, anything I missed, or Sean, that you want to call out? We're going to go through pictures. Think about it as you do. This just gives you a view as you look north coming up Highway 10 here, Ontario. So you can see that view, that shows you the back end of where the emergency department is. And then the pictures of the common centers as you're walking in. So those pictures from the interior are as you're walking into what we would call the celebrated entrance off of Queensway and Hurontario, that is also the center of where there's a new transit hub in the Hazel McCallion light rail transit. So this is now going to be a health-oriented hub in our city, and it will be a health-oriented hub that delivers the most specialized care to the most diverse community in the world, delivering research and innovation. And we have plans to build the community around us with the property that we still have to be a total health-oriented community center. So this is a very exciting project. We're happy to answer questions as we go along, but exciting to show you the pictures as well of where we have gathering places. And you can see the healing environment of a lot of sunlight and a lot of trees coming into this facility. Okay, we better keep moving along here. Oh, this is a great picture of the site plan. So I've described Hurontario and where the new hospital comes up along Hurontario all the way to the Queensway. So you see this is pretty much a full city block here that this new hospital will exist. The proposed parkade you can see down at the south end of the site, and that adds additional capacity for parking. And then I want to call out two other things. One, there is a newer part of the Mississauga Hospital. We call it the J Wing. That is actually going to be maintained, and that is a place where we will be able to deliver kind of restorative care to people who may not require acute care anymore. That specialized episode is done, but they're not ready yet to go home. And so that will be a facility that we use for that kind of supports as we get people ready for home. And then I mentioned before where the old hospital exists, we will be building out plans with our community for mixed use development that's totally focused on that kind of health-oriented community. Okay, let's keep going. The project that we have underway right now is the Gilligan Family Queensway Health Center, an incredibly exciting addition to the Queensway Health Center as it exists now. This is a state-of-the-art 600,000 square foot, 9-story facility, totally focused on rehab and complex continuing care. Mississauga does not have a dedicated rehab and complex continuing care facility. And so this provides us with that center of expertise and specialization for people who are ready for that level of care and as they transition home. We've already opened a parking garage to add parking space here. And so as you think about an entire system of care, we now have people who will be able to receive that kind of ability to be rehabilitated after a major specialized acute event and or are complex and require some continuing care, to have them to a place where then they can transition to either long-term care, home, or another kind of facility where they can be cared for. This is a very exciting project. It's a major addition of this kind of capacity in our community. And like I said, the cranes are up now. You'll see more pictures in the community as that work is underway, but very, very exciting shovels in the ground earlier this spring for this project. Okay, I think the pictures of parking garages, here we go. Always important, because we know parking is one of the things that people have real difficulty with at our sites. There's no question, we hear that feedback all the time. I mentioned the parking garage that's already open at the Gilligan Family Queensway Health Center, 1,400 total parking spots there. It's a very nice new facility. And then the new parking garage that we are building is 2,500 new parking spots, and that will be connected also by a bridge to the new hospital, a walkway. so that we can reduce foot traffic across what will be a very busy urban site. And that hospital also has, the one behind me, the Peter Gilgan, it will also have 2 levels of underground parking below it, which is very, very, will be totally dedicated to our patients and families. And it's a big bonus to have that. Okay, let's keep us moving along, Lauren. I do want to just show you what I mentioned earlier, which is that new seniors campus of care at Wellbrook Place. I mentioned to you already 632 beds of long-term care. It is a very, very special facility, and all kinds of opportunity as we think about the land that we own there at on Speakman Drive, and the ability to build out additional services to help support seniors at home. I want to say it's a very important part of the city that has a special school called Olive Grove School, which I know will be familiar to many people on this call. And the CEO of Partners Community Health and I think have a commitment in place to go and visit Olive Grove School, because that is where you get some really neat opportunities to see how young kids and seniors and really building in the connection to the community can happen. That's truly a new kind of healthcare for a healthier community. And hopefully inspiring future doctors and nurses, just like Farah Khan described in growing up in this community and now being one of our most senior clinical leaders at THP. Okay, next slide. This is the summary slide. Okay. So in summary, with a few minutes to spare, if there are any questions, we just want to thank you again for the incredible support. We do say here, hospitals can help support communities, but communities build hospitals and healthcare. And so we are taking advantage of this moment in time as we are embarking on this massive, massive infrastructure project to do things differently and to do this with our community so that we can build something that's extraordinarily different and really does change the healthcare system for not only our community, but demonstrates how communities come together to build better healthcare overall. And so thank you for dialing in and taking some of your precious time to learn more. Thank you for your ongoing commitment. It is always incredibly humbling, I will say, to be with members of our community who give so much to the community to help make us better. You are a very special community to us and in your commitment to building community. So thank you. And we are happy to answer any questions and also take your advice on how we continue to engage across all parts of the community. So thank you. Just thank you for taking your time, for being there with us. And we look forward to more engagement as we go forward. And have a great night.